Aloha and good morning, everyone. Welcome to the Sunday edition of the COVID Care Conversation. This is a discussion about the coronavirus pandemic, specifically resources for us here in Hawaii. Good morning. I'm Yanji Denise.
To unmute myself. There we go.
There we go.
Me now. We want to welcome you all here. My name is Ryan Kalei Suji, and this again is our daily conversation, keeping you informed of all the things that are happening here in Hawaii and beyond concerning the COVID-19 pandemic that is affecting a lot of people. We've been able to talk to a few people during our show and broadcast today. We actually have a very special guest.
Yeah, that's right. Dr. Rupi is here today. She specializes in internal medicine and specifically in acute care. We're so lucky to have her. She works at a number of hospitals throughout the state, and she can tell us what we need to be doing to protect ourselves from the virus and what to do if you suspect that you are in danger. We're also going to talk about some practical things. What does it mean to self-quarantine? What does it mean to isolate? How do we actually go to the grocery store? We're going to get into all of that. So she's going to be joining us in a few minutes. In the meantime, please type your questions for her in the comments, like and share this video while you're there. And we want to say good morning to Antonio, Kanani, Lou, Julie, and Cheryl. Thank you so much for joining us this morning. We want to get straight to the headlines while we wait on Dr. Rupi, and we always begin with the count.
That's right, the count continuing to go up as state officials expect as more tests become available. Yesterday, 29 more cases, bringing the state total up to 151. Again, Oahu leading with the amount of cases. We also saw a number of, or got reports that actually a Honolulu police officer and firefighter both tested positive for COVID-19. However, we are getting word that those officer as well as the firefighter did not get exposed to the disease while at work. They were both on personal matters or got them outside of work and have since been self-quarantined during that time after finding out that they did test positive.
Yeah, we expect to see a lot more cases. The thing to remember about the transmission and the virus count right now is that these results, there is a lag time with the testing that's being done. It takes 3 to 5 days to process many of the tests that are being done. So the counts that you see, health experts tell us that they don't reflect the actual level of the virus in our community, which is why it is so important to stay home and self-isolate as much as possible. Folks who do want to be tested can head to Kaka'ako Waterfront Park today. That's from 8 to 2. Yesterday, we did see the drive-through testing in Waipio. We're told that about 1,200 people showed up. Of those, 260 were tested. You have to meet criteria to get a test, so that includes physical symptoms along with travel history. They are screening for that because they obviously don't want to test every single person that comes there. We are told that there are enough tests right now, but they don't want to exhaust those tests for people who don't actually need them.
That's right. And again, we're going to see that happening in Kaka'ako today, those long lines. And so you got to imagine for those 1,000 people who show up, only 260 met the requirements. Want to encourage people to really make sure that you do meet those requirements before showing up and waiting hours in those long lines. It's important to sort of just make sure that you are matching sort of the criteria for that testing.
We want to go ahead and bring in Dr. Rupi. She, as we said, is an internist and she specializes in acute care. We are so lucky to have her with us. Good morning.
Good morning.
So we want to start off with the basics. Let's talk about some terms. We're all told to shelter in place, to stay home. What does it mean to self-isolate? What should that actually look like?
So there's a lot of confusing terms. And when we talk about self-isolation, staying at home, work from home orders, those are different than actually quarantining yourself. So I'm going to start with, what does it mean to stay at home, work at home, social distancing? This means that you have not come into contact with somebody who's COVID-19 positive. This means that we're trying to create social distancing to help decrease the spread of infection. And by staying at home and not exposing to others, this will help control the potential spread. And so mainly staying at home means just that. staying at home, trying to avoid being around others, and especially in big groups. Some folks I'm still seeing, as I've been, having to go to the hospital or having to go to appointments for myself, I've actually been seeing a lot of folks still out and not taking the social distancing seriously. 6 feet of distance between anyone around you. If you have essential requirements, meaning needing to go to the grocery store, meaning needing to go to the gas station, those are essential things that need to take place. But making sure that you're using the appropriate precautions, hand washing, respiratory hygiene, particularly. If you do have a cold or cough, you should not be going out yourself. You should actually be sending somebody if at all possible. Now, upon returning, making sure to wash your hands. We've all talked about the 20 seconds, making sure to get into all the different spaces in between your fingers, your nails, doing that, but also disinfecting commonly touched surfaces. So if you do have to leave for essential work, making sure that the folks that are in that location are disinfecting. So I know the grocery stores and whatnot are using disinfectants, but also for yourself, when you return, anything that you're bringing home with you, you do want to disinfect as well. So those are pieces of social distancing and staying at home, work from home.
So let's say we go to the grocery store and we bring back a bag of groceries. Does that mean actually wiping down a box of crackers or a carton of milk, or, double washing your oranges? What does that actually look like?
It looks like just what you said. So you do want to take the appropriate precautions. The problem is we have been learning about this virus. It's a new virus. We didn't know much about it because it was never existed in humans. So all we've learned has been in the past couple of months since it made that transition from animals to humans. What we're learning about is that it can survive on surfaces for longer than we originally thought. So it can survive on plastic, metal, and even cardboard. So what you want to do is make sure that you are wiping down any surfaces that are exposed to potential folks that might have the illness. Now, the illness is getting transmitted even in an asymptomatic state. What that means is people who don't have any symptoms could still be shedding the virus. That virus could get onto surface like cardboard, or it could get onto a plastic, and then you could touch your face, and suddenly now you have had exposure. So you want to make sure that you're using the appropriate cleaning precautions. Now, the CDC and the EPA.gov both have lists of disinfectants that you can use. I also have them linked on my website at drrupi.com. But those are the disinfectants. They tend to be Clorox, Lysol, that you can use to wipe down surfaces to help to kill the virus. Now, another option that I've been hearing a lot of folks on the mainland doing is if you do have delivery services or you need to bring groceries into the home, anything that's non-perishable, leave it for 3 days in your garage if you can. So don't be touching it, don't be interacting with it if you don't have to. Now, obviously with perishables, you need to get that into your refrigerator, but make sure to wash your hands appropriately after you've touched all those surfaces. Make sure you're not touching your face.
We're getting some questions that are already coming in, so we're going to pop one up. One is from Teal right now. They're asking for sanitary recommendations for people working in food delivery. We're seeing a lot of these Uber drivers that are now doing Uber Eats. What sort of recommendations would you have for people like that?
So along those same lines, again, those really basic respiratory and hand hygiene precautions, along with disinfectants. So I know there has been a little bit of a shortage of getting some of the wipes and whatnot, but take a look at that list that's available, and we can link to it. I can send that over to you to add to the website as well, so that folks know which types of disinfectants to use. Now, keeping that distance, I've noticed that a lot of the food delivery folks, and they're keeping that appropriate 6 feet of distance between themselves and other individuals. If you have the option of leaving things so that there doesn't have to be personal interaction, that would be best.
Okay, wow. It's so much to think about. I also wonder, I'm looking at all the questions that are coming in. Interested to know if someone starts to feel like they're getting run down and they're worried that they may have contracted the virus, what are the first steps that they should be taking?
So at this point, the situation continues to evolve, and looking at the mainland, we're not at the mainland level yet as far as transmission in the state. Doesn't look like it so far, but we seem to be a couple weeks behind them. So we need to really act now to make sure to try to avoid as much spread as possible. So if somebody starts to feel unwell, you can make the assumption that there's a chance it could be COVID. If it is, or even fevers, not feeling well, starting of a cough or sore throat, the best thing to do, especially if you live with others, is to isolate yourself. So those terms we talked about earlier, the difference between social distancing, staying at home versus quarantine, or self-isolation. Self-isolation and quarantine means that you're separating yourself entirely because either you have the symptoms, you have COVID-19, or if you have come across somebody and been exposed to COVID-19. So what to do in that case? Again, your question about the symptoms. Self isolation means completely separating yourself from others. By doing so, you are finding a location in your home that's separate. So it could be a room, you could have a different bathroom. Those would be ideal situations. Obviously, in the islands, a lot of folks live in multi-generational homes, and it's really difficult to separate entirely. So what you want to do is designate either a corner of the house or a space in the house that's at least 6 feet of distance from others, and make sure that you're disinfecting surfaces that you guys commonly touch together. You want to try to avoid that. So trying to, like I said, have a different bathroom if possible. Kitchen is another shared space that's often very difficult to separate. So making sure that the person who is sick is trying to stay away. If they're coughing, wearing a mask, ideally, to protect others from their droplets, making sure that they're not having visitors come over, and making sure that they are trying to limit the contact as much as possible. Now, when it comes to tissues, folks who have cough or are sneezing, having your own separate wastebasket that you have a plastic bag in. When that fills up, you're going to want to double bag it and keep it for 3 days before you put it into the garbage can. That's going to limit that spread as much as possible because we don't know if there's a chance somebody else comes in contact with it that it could spread to them as well.
Oh, great advice. We also had some questions that came in at coronavirushawaii.com. A lot of people just more about the testing side. They were wondering, and we saw some of this where people were turned away yesterday at some of these drive-through testing. Is there a certain number of symptoms in order to get tested? Sort of like, do you need to get 3 out of the 5 criteria? Like, what is sort of the criteria in terms of how people know that they're going to get a test or not?
That's a great question. We have very limited tests available on the island. So we have to be very careful about who we're testing until we get more tests. There has been a big push to try to get as much tests as possible. I can't speak to what the status is on that, but us in the healthcare community are really pushing to try to get more testing because we need it. Now, for the fact that we don't have that amount of testing that we need to be really careful with who we're testing and how we're testing. So the folks who have symptoms are the ones that we are testing. The ones who are hospitalized obviously get first priority because we need to know who in the hospital actually has it so they can be managed appropriately and isolated appropriately. Now, the rest of the folks who have symptoms, so meaning cough, shortness of breath, fever, and potential exposures, healthcare workers, those that are high risk are going to be the ones likely to get tested at this point until we get more testing. Now, the concern I have is all the folks going to these testing centers who might potentially be exposing themselves to others who might not actually have COVID, but now they've gone to a group of 1,200 people who potentially there could be spread. We really want to avoid groups here. I think that's one of the main things that we've learned from the spread around the world is that groups are conducive to spreading. And if somebody's coughing or sneezing into the air, those droplets are creating spread. And so somebody walks by or is in close contact, suddenly now they've been exposed as well. So the key here is if you think you have symptoms to either call your physician or use telehealth. We're really pushing for telehealth across the islands. Now, as far as accessibility to telehealth, at this point, everyone should have access. They've really pushed out, insurance companies have rolled out their own platforms. I work on a platform that folks can use without having health insurance. It's just there's a payment feature. It's around 40, 50 bucks. But folks can go to that instead of going to the testing centers unless they actually have all of the symptoms. Mm-hmm. Even then, you can still utilize telehealth to be assessed by a physician virtually, just like we're doing right now. And that way you can talk to them and find out if you actually need to be tested. So on our service, what we're doing is we're assessing the patients and then deciding, are they at risk? Do they need to get tested? And if you do, we're going to fast track you to different facilities to get the testing done right away so you don't actually have to wait. So that's the best way to do this, because otherwise you're waiting in line. you're surrounded by a lot of people, and you may or may not get tested because you don't know if you need it.
Mhm.
So being very cognizant of that, I think, is really important, and pushing that telehealth, because that's going to be your best protection. You can do it from the comfort of your home. You don't have to go out and expose yourself. And it also prevents that mass influx that overwhelms the system. Because that's another thing I'd love to talk about at some point, is that we've got limited resources, and we're still very early in this disease process here in the islands. So we need to figure things out, and we need to figure out how to manage how we're going to handle these upcoming situations, because right now the numbers are small. As this thing grows and as more people get exposure, we're going to start overwhelming our hospitals, our urgent care centers, our ERs, and we really have to know, what should I do if I get symptoms? What should I do if I start feeling unwell? And also knowing the alarm symptoms. When should I go to the emergency room or call 911? So, sorry, I'll keep rambling. So let me know if you have any questions. If, as far as alarm symptoms you need to be worried about, or that you need to be calling 911 and getting into the emergency room, is if you're shortness of breath, and that means really having trouble breathing, not being able to do your routine activities. So meaning you're walking from, short distance and you really feel winded, or you can't speak in full sentences. If you get chest pains, if you start noticing confusion, like grandpa starts seeming a little bit confused, those are all signs that you need to be calling 911. Bluish discoloration to your fingertips, your nose, your toes, those are also signs that you're not getting enough oxygen. So need to call 911. Let them know that you're concerned about COVID-19, so that they can appropriately prepare to come see you and get you over to the hospital.
I think Tio's got a good question here. Just going back to the practical life, asking, I've heard that the virus can last 13 hours on clothes. Can you confirm this? Should people wash their clothes immediately when returning home? So let's give that scenario. I go to the grocery store, I buy my items, put the non-perishables in the garage, take what is perishable inside the house, wipe it down. What about me? Beyond washing my hands, do I need to wash everything I've worn?
So at this point, we know that there is community spread that's occurring. However, it doesn't seem widespread that if you're walking through a store without people coughing on you, without having that exposure, it's unlikely that you're picking it up in your clothes. However, if you are around somebody who might be COVID-19 positive, the best thing to do is to wash your clothes on heat with heated water, and make sure you use a dryer, because heat does seem to kill the coronavirus.
Right. We also have Sabrina. I mean, this is more practical. I think this is just kind of overall, is more Motrin okay to take? I mean, we know that there's not necessarily a cure, but if they have some symptoms, what should people be taking, I guess, over the counter?
So that's a great question, because there has been an association in the news. I've seen this being talked about, that Motrin, meaning ibuprofen or Advil, they're all the same, could potentially contribute to worsening of symptoms for COVID-19. This has not been adequately studied. There hasn't been enough proof that this is actually the case. But in general, we do recommend Tylenol. So if you've got a fever, the best thing to take is Tylenol. And that's actually something that folks should have on hand at home, so that in case you were to develop symptoms, I've talked about quarantine a little bit, and I talk a lot about it on my website, because I want folks to know what to do in case they're quarantined. But I also want folks to know how to prepare for quarantine, so that if you're suddenly told, hey, you've had exposure, or you might have COVID-19 and you need to quarantine, you're not suddenly running to the store to go get everything. You should be prepared, because we don't want you going to the store at that point. So having Tylenol on hand is actually a really good idea, as well as cough and cold medication, so that you already have it at home. In case you come down with symptoms, you have access to it, or your family members have access to it, but so that you're not leaving your home.
It's like an emergency kit, basically,
Yes.
just preparing.
Absolutely.
I know the virus is still so new, so it's hard to say, why certain people have certain outcomes. But why do we see this vast array of response that, the vast majority, as we understand, they survive it and they can come out on the other side. The symptoms are relatively mild. For that 20% or so who are experiencing severe symptoms, or severe, I don't know what the word is, but who are getting hit really hard, what is the difference? Is it your health beforehand? What can we do to prepare our bodies so that if we are exposed to this virus, we end up in that 80%?
So we've learned so much in the past couple of months. So things started obviously in China. We started seeing mostly the elderly, mostly the immunocompromised being affected. And when I say immunocompromised, not just the folks that are on chemo or just the folks that are on steroids or have some sort of medical condition that leads to immunocompromise, but even chronic medical conditions like diabetes, high blood pressure. So those are known risk factors for worsening condition or development of more severe symptoms. However, in the past week or two, watching what's happening on the mainland, and I have a lot of folks in my world that work on the front lines in New York, Chicago, New Jersey, where they're getting hit really hard right now. And they're seeing younger and younger patients, which up until now, we've kind of said, oh, it's just, these high risk folks. And now suddenly we're seeing a lot of young patients without a lot of medical problems ending up on ventilators and ending up in serious trouble. And so we're seeing that this is much more dangerous than we actually originally were thinking. And we really underestimated the potential of this virus. Mm-hmm. So as far as who's getting affected, it still does tend to be those folks in that high risk category, but that doesn't mean that everybody else is necessarily safe, right? There's still potential. And what we think that potentially could be related to is viral load. And what viral load means is exactly how much contact they've come into or how much that virus is affecting them. So we don't know this for sure, but if someone's exposed to somebody who has the infection versus being exposed to multiple people who have that infection, or a very close contact, such as healthcare workers, we tend to be seeing a little bit more severe response from them. So that's why we're seeing a lot of healthcare folks on the front lines on the mainland ending up into respiratory failure and in the hospitals right now.
We're getting so many questions that we're sort of running out of time. I just want to get to one more question before we have to end the show. But this is a direct question from Michelle. She said, what about a senior with a sore throat for about 2.5 weeks? It started 3 days after going to Kaiser. What recommendations, I guess, would you have for somebody who is experiencing a sore throat for that amount of time?
So monitor them very closely. If that's a family member that's asking the question, making sure that they're being monitored and checking their temperature. So what we've kind of been seeing is watching the temperature twice a day is a good idea because the temperature can fluctuate. And if that person was to start getting a fever, make sure that they get onto a telehealth platform. I'm sure Kaiser has something set up where they can see a doctor virtually, but making sure to utilize that. So if a fever develops, especially, they probably should at least talk to somebody or potentially get tested. Now, at the same time, like we talked about earlier, if somebody is worried about symptoms, self-isolating, because what happens is that these symptoms can start kind of gradually, they don't seem too bad, and then suddenly we find out a couple days into it that it could be COVID-19. And so during that initial phase, it's really important to protect everybody around you from also picking up the same virus. And so again, we're going to go back to those measures: disinfection, separation, and making sure to use really good hand hygiene.
I want to get to this question from Kim Coffee Isaac. If we think we already had the virus, is there good reason to know for sure? And beyond that, I'm curious to know, is there any way to know if we've had it and it's already gone through our system?
Not at this point. So hopefully in the future, they will be able to test for antibodies. But at this point, there's so much focus on getting testing. There's so many things we don't have that we need from the front end that eventually we'll probably be able to find out from the back end. But at this point, we don't know for sure.
Great.
Or there's no way to know for sure.
Right. Yeah. Well, thank you so much. And we're still seeing questions come in. We want to do this again, obviously, because it's been a good resource for people out there. We're seeing a lot of questions. So thank you for your time. And we'll provide some of those links that you were talking about in some of our show notes here so people can always go back for any other questions that they may have and they want to maybe follow up directly with you. So thank you so much.
That's great. You're very welcome. Thank you.
Thank you.
Take care, guys.
Wonderful to hear from her. And I think, that practical advice about going to the grocery store or if you have an outing, and it really does have to be something that is very necessary. Don't just go out just cause, right? We really want you to be going out only for the essential services like getting gas for your car or going to the grocery store. And if and when you do that, I think her point about having to wipe down, I mean, like, are you out there wiping down the box of crackers or your cereal or the milk cartons? You know, we need to be very vigilant about this because it seems like, as she said, the virus is living on surfaces for longer than we suspected. So that's really important to note. We're going to have her on again later in the week. And if you have immediate questions for her that didn't get answered today, you can go to coronavirushawaii.com. There's a platform there where you can actually ask Dr. Rupi more questions. She was fantastic.
Yeah, it was great. And again, we want to just be able to provide that opportunity for all of you tuning in to ask those questions. So again, stay tuned to our platform. We'll let you know the next time we have this segment on, and so that you guys can make sure that you tune in for that. Again, not only do we want to highlight some of the things that are happening, of course, and giving you information, but we also want to highlight the great things that are also happening in our community. One of them is Value Furniture. Actually, they are going to be doing a Kapuna care package that they are going to be putting together. Actually, today is one of their first days of their drive. So some of the information is there. What you can do is you can actually drop off your any sort of items that you may want to add to this Kapuna care package. They're actually going to be collecting them. You can see there at their stores, at the furniture store at Kamakana Ali'i, as well as here in town in Oahu. And they're going to be putting together masks and different types of things that you can donate to those in need, the Kapuna out there. There's a contact number. We'll also put this in there, but we want to thank them for their support in this time. Again, we're seeing a lot of businesses sort of step up to help. A lot of people have a heart for the Kapuna, and we know that they are isolated just to protect themselves. And so care packages like this would be great. So thank you to Kyle Sina and the team over there, Value, for doing that for our community.
Yeah, our Hawaii hero of the day. If you've got a hero that you want to nominate, put it in the comments and we'll be sure to check them out. We also, of course, want to give you resources. There's a great article in the paper today highlighting Senator Brian Schatz has released a resource guide for small businesses in Hawaii to help them navigate the tremendous package, that $2 trillion coronavirus aid, relief, and economic security package that was, of course, signed on Fridays. He's got a great link on his website, and it's right there, shots.senate.gov/coronavirus/small-business. We will also put this in the show notes afterwards. So that you can go on there if you're a small business and figure out, because that's a lot of money and it's hard to know, where do I fit in if I have a small business? There are a bunch of different resources that will be available in the coming days and months. And so we want to make sure that you have access to that. The senator has made it really simple. So we want to, we'll link to that and make sure that you take advantage of that, because that is your tax dollars at work. And if you own a small business, we want you to stay in business.
Yeah, and there is, it can get confusing. If for those of you who have a small business and are going to go to that website, there's a lot of information that's going to be needed. You have to be able to basically allocate and be ready to spend a few hours working on this form, because you're going to have to go through some of the financial sides, and there's going to be a lot of information that you have to input. There's actually a credit that goes specifically for payroll, because they want to make sure that people are staying employed. So there's actually an opportunity to have part of those fundings go to help cover your payroll specifically. There's also tax credits, other things. The other thing for the first time is for those vendors. So for those of you that may be a musician, an Uber driver, people that are not necessarily employed by a company per se, you are now actually falling under this category as well. They want to make sure that they're supporting those as well. So again, a lot of information posted there on the senator's website.
Yeah, wonderful to see that 1099 workers are also included in that aid, because so many of us do work in the gig economy. The city has a hotline for questions about the stay-at-home order. That number 768-CITY, 768-CITY. But the best advice, stay home, essential stuff only. Tomorrow, of course, Monday, it's a day that you would expect kids to go to school, but they won't be. But the DOE is still helping to make breakfast and lunch available. So there are a full list of campuses where lunches and breakfasts are available, hawaiipublicschools.org. 65,000 students across our state rely on those meals every day. So we know that there are a lot of families, and now with the economic hardship, people being furloughed or laid off, we know that so many people need that assistance. So hawaiipublicschools.org has a full list of the schools, the campuses that are giving away free food, breakfast and lunch Monday through Friday.
And following up on what we discussed yesterday with, IHS, they are also looking for volunteers as well. Of course, the homeless population, very critical in this time. We want to make sure that they are staying safe, that those who may be potentially exposed or sick are getting put into a quarantine station. So they are actually looking for volunteers. If you are interested in helping them out in this effort, we want to invite you again to go to coronavirushawaii.com. How we can help. We actually have a section on there where you can fill out your name and your contact information, and we will actually pass that along to IHS so that you can get connected there as well. But we want to make sure we support them. And thank you to Connie and her team for all the things that they're doing out there. They're doing a wonderful job in keeping that population safe.
Absolutely. So this show, this Facebook Live broadcast is your chance to connect with each other, to connect with the community. We've got a great week planned for you. We're going to be hearing from a representative from the Hawaii State Unemployment Office. I know a lot of you are out of work or worried that you will be out of work soon. So we're going to bring someone on to answer all of your questions. We've also got an ABC News correspondent who is from Hawaii and now lives in New York to talk about what it is like to live, to report on the front lines. New York City just being hit tremendously hard. So we do look forward to hearing from her. We're so excited to hear her dispatches from the front lines. And we have Dr. Sarah Sarkis, who is a therapist who is going to be talking about mental health and self-care. That'll be on Friday. So we've got a lot of great guests coming up, but we also want to know from you, what would you like us to talk about and who do you want us to bring on? Wonderful to hear from Dr. Rupi. I think I want to have her on again this week.
Yeah, for sure. We definitely want to do that. And again, this is all of an effort that we at the Honolulu Star Advertiser want to be able to provide you these resources. So again, we have a great section on the paper website that is directed specifically for coronavirus. All the articles that this paper has published, all the closures, any information, it's a great resource as well. We also want to make sure that we give a shout out to our sponsor. We're partnering in this effort with the Hawaii Executive Collaborative to bring you this conversation. And really, they are a collection and a collective of business and civic leaders who are sort of coming together to help in different times. Of course, what great way for them to come together right now to help provide information and keep people connected. So we thank them for their efforts in helping us get this message out there as well.
Absolutely. And you can help us get the message out. Share this post on your Facebook page, like it, leave us a comment, help us get the word out and spread the wonderful information that Dr. Rupi offered us today. Have a wonderful rest of your Sunday. We will see you right back here, 10 o'clock tomorrow on Monday. Until then, aloha.
Stay safe, everyone. Aloha.